This video is specifically about increased neural tension in your sciatic nerve. We're going to look at what causes it, how to test for it, and also what exercises may help. For those of you who don't know me, my name is Marika. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment for your injuries. Have a look at the description of this video if you want a link to our website. So, what is increased neural tension? If we look at the nervous system consists of your brain, your spinal cord, and the nerves that runs into your arms and your legs. As we move, the nerves are all meant to slide freely, but sometimes something prevents the nerves from sliding, so it can either hold onto it or press onto it, and then instead of sliding, the nerve is stretched, and that's when we talk about increased neural tension, and it can cause a variety of symptoms. If we look at where the sciatic nerve runs, your spinal cord runs in your spinal canal. So you've got several vertebrae stacked on top of each other, and they have a canal in them that protects your spinal cord. Your vertebrae also has a disc in between them and smaller holes to the sides where your spinal nerves exit at each level. Your sciatic nerve is formed by the lower spinal nerve, so your L4 to S3 spinal nerve, and they come together, run underneath the sacrum and go through your buttock area. And your sciatic nerve is as thick as your thumb, so it's quite a robust nerve. It runs either underneath your piriformis muscle or through it, and that's why the piriformis has such a big role in increased neural tension often. Then it runs quite close to the hamstring muscles down the back of your thigh, round about the area of the back of the knee. It splits into two branches, and one branch goes down straight down the back of the calf, and another one just comes round the leg to the side of the lower leg. And it runs quite close to the head of the fibula, where it can often also cause pain when it's irritated. And then it comes round the foot. Now, the sciatic nerve can get stuck at any of those points or be prevented from sliding freely, and it can cause symptoms all along that line. So, what can cause the nerve to get stuck or the sciatic nerve to get stuck? So the most common cause is increased or tight muscles and fascia. And this is often caused by either staying in a position for too long, so spending loads of time just sitting, or repetitive movements, having a job where you've got to do the same movement over and over again, or just doing a lot of sport and not doing any flexibility or mobility work. And this is the easiest type to fix, because it's all about just changing your habits and doing some exercise to loosen it off. But the nerve can also be prevented from moving freely because of a disc injury. So a disc may be pushing onto the nerve. Another reason may be if your bones change shape. So if we think of osteoarthritis, you can get little bone spurs and things sticking out, and that can then stop the nerve from sliding freely. Or sometimes if you have an injury that causes scar tissue to form, it can attach onto the nerve and then stops it from sliding freely. And this is quite common in hamstring strains or calf strains where people don't follow a proper rehab plan, and then the injury doesn't heal in a functional way. And that can then cause the nerve to get tight and stuck. Also, for high hamstring tendinopathy, if it goes on for a very long time, that can cause what we call adhesions to attach onto the nerve and stop it from sliding freely. Also, if you have an acute injury like a muscle tear, for instance, either calf tear or hamstring tear, that causes local swelling and increased pressure, and the muscles just go into spasm to protect the injury. So you will likely find if you have a new hamstring or calf injury, you will also have increased neural tension. But you know what? You don't have to do anything about that type of increased neural tension usually. If you follow the correct rehab plan for your calf and your hamstring muscle, your neural tension will decrease as the calf and hamstring starts to function as normal. So quite often, you first have to identify the cause of the neural tension so that you know whether you need to treat it or actually address something else so that the nerve can become free. Because one of the biggest mistakes is that people try to loosen the nerve while the cause is still there, and then you just irritate it further. What are the typical symptoms of increased neural tension in the sciatic nerve? Well, you may have no symptoms, because if you don't do activities where your leg moves enough to actually tug on the nerve, it won't get irritated. So it may be that you don't have any symptoms at all. Then it may cause pain. It may cause referred pain. Often when a nerve is annoyed, you don't feel the pain in the area where it's stuck. It's lower down that you feel it. Typically, there may be things like funny sensations, burning, tingly, numbness that can go hand in hand with this. It doesn't have to be. It is also often that people are actually reporting things like repetitive calf strains or repetitive hamstring strains without a clear cause for it. So we know from the research that if your nerve's not free to slide, it may predispose you to getting calf strains and hamstring strains more often. So there are lots of things that your physio will listen out for to know whether they need to test for neural tension or not. The other important thing to understand is that it can sometimes mimic other injuries. So for instance, where the branch of the nerve runs around the fibular head, that's quite close to where you feel the pain from things like IT band syndrome. And you can get it misdiagnosed. So it's important, if you see an experienced sports physio, they will usually test for things like increased neural tension to rule out while they're doing the other tests as well. And these tests, you don't need any special tests. It can be done via movement tests that I'll also demonstrate in a minute. How do we test for increased neural tension in the sciatic nerve? It's actually very simple. You get a patient to do a slump test. Now, before I demonstrate it to you, there's a few things to note. First is that the slump test is not appropriate for everybody. If you have an acute disc injury, your physio won't get you to do that because it may actually make your injury feel worse. So it's not safe for everybody to do, and your physio should guide you whether this is a good idea or not. Second, if you do have a muscle strain or tear, the slump test will likely be positive, but that doesn't mean that you have to go in and treat the neural tension. As you do the rehab for your muscle tear, your neural tension will usually resolve, but it is something worth testing towards the end of the rehab to see if you need to add anything into it. Then there is no gold standard. There is no such thing as everybody has to be able to move this far. How far you can move and how flexible you are in this test will be determined by your genetics and how tight you are compared to other people. I'm going to annoy you because I'm quite flexible, so you may go, I can't do it as far as you can. That's fine. What we're looking for is a difference between left and right side. So if you're quite stiff on the left, where you get your symptoms, we want to see that you have the same range of movement on the right. Then it means that neural tension is not an issue. But if the left, where you get your symptoms, is a lot tighter than the right, then it may mean that increased neural tension is part of your symptoms. We're also looking for, it is normal to have increased neural tension depending on the activities you've done or the time of day. So typically people are stiffer first thing in the morning, has more range of motion later in the day. That's a normal fluctuation. Yes, so let's get going and I'll talk you through it as we go on. To perform the slump test, you want to sit on a sturdy chair. So you don't want to sit on one that's going to let you sink in. It's going to be something like a dining room chair. Now, to tension this sciatic nerve and the nervous system, it's continuous from your brain, spinal cord to the tip of your toe. So we're going to use that whole line to see how free it is to slide. So the first thing you do is you place your hands behind your back and you just kind of hold them like that. Now you want to place your chin on your chest and then you want to slump down. So you want to get some sort of a rounding in the spine. I'll sit forwards a little bit that you can see that. So you don't have to be super round. You go as far as normal for you. But what you don't want to do is bend from the hips. You're looking for the spine to curl down. If you can do that, but you can't really get any bend in the spine, then it may mean that your back is tight. So you do that and you hold that. Then you want to straighten one leg out. Now, I'm going to shift back so you can see my feet. And you may find that your leg can't go straight. So you may only find that you can go to there. And that's okay. If you get there and it really, really pulls, see what happens if you lift your head up. Now, if that releases the pull and you can suddenly go straighter with your leg, that's a positive sign that you've got increased neural tension. If, however, you look up and you go, no, it doesn't change anything in the tightness I feel, then it's your hamstrings that's tight. It's not your nerve that's tight. Second, if you could get all the way straight, then you want to see what happens if you bend your toes towards you. Now for me, that gives me a lovely stretch in there. And if I lift my head up, it doesn't really change much. So that shows me that it's more just my muscles that are a bit tight. It's not really my nerve. To be honest, if you can get into the full position and you feel a tightness that is nerve, that's still really good range. I'm not going to say that's a positive test because that's the full range that you can get. But most of the time, if I look at athletes, especially the guys, they tend to not be able to get their legs straight. They get it to about there, and that's normal tightness if they are both the same. So then you want to do the other side. You want to see if I come into this position, can I get the same range? And I can get the same range. So this means for me, I don't have increased neural tension. Why do we get the neck to move? Because if I'm in this position and I have my legs straight, now my nerve is most tensed. If I lift my head up, I release the tension on the nerve, but I still have the tension on the muscles. So if what I feel in my leg changes, it has to be part of the nerve that changes it. If it doesn't change, it means it's more down to the muscles what you felt. So how do you treat increased neural tension if it's found to be a problem? Well, the first step is you must address the cause. Because one of the biggest mistakes I see is people go in and try to stretch and move the nerve when actually it's still stuck. So if something's stuck and you pull on it, it's just going to become irritated. So if your cause is a disc injury or back injury, your back injury needs to be addressed. If you've torn your muscle or and you've got an acute injury, treating that injury often resolves the neural tension by itself. So it's really important to understand the cause and make sure that that cause is first addressed. Now, the second thing that I see people do wrong is that they go in and really try to move the nerve in with a lot of force. Nerves are very sensitive. They're robust, but they're sensitive, and they can get irritated quite easily. So in my experience, it's better to take a longer period of time to loosen the nerve up and be gentle with the exercises than to try and really stretch it. So what I like to do is if it is that I find people are just stiff and tight because muscles holding on to it mostly, so we've done all the rehab and other things address the cause, but now it's just muscle tightness causing the trouble, I like to loosen off all the muscles and everything that surrounds the nerve first before I get into any of the gliding exercises. So I'm going to demonstrate to you now an exercise routine that's useful for anybody who's got increased neural tension in the sciatic nerve due to tightness in the muscles and the fascia. This is not appropriate if you've got a disc injury or anything else serious wrong with the nerve. So check with your physio before you do any of these. And if you feel that it actually increases the sensitivity when you do it, or you get pins and needles or anything while you're doing it, stop doing it, because that just shows that it's actually irritating the nerve. So I'm going to run through these. The number of repetitions and things I say is just an example. You must find what works for you. Okay, so the full routine that I give my patients consists of about 8 exercises. But if we find that they are really stiff in one area versus the other, I may get them to first focus on just the first 3 exercises for the first few weeks and then add others as they loosen that off. So I don't normally get people to jump in with all 8 these exercises. I get them to add them in one at a time as other areas improve. But your physio will be able to help you understand what's best for you. Okay, so for the calf stretch, it's very simple. It's the typical runner's stretch, works really well. You can hold on to something if you need to for balance, because it's not a balance exercise. And you just want to place one leg straight back, heel is on the floor, and your foot is pointing straight forward, so it's not turned out to the side. And the other leg is as far forward as is comfortable for you. If you're struggling with it, do a smaller step. If you don't feel it much, larger step. And as you bend the front leg, you want to keep the back heel on the floor. You can hold it for about 30 seconds, then switch over, do the other side. But like I said, don't go deep into the stretch if it's super uncomfortable. Just go to where you feel the sensation of stretching and hold it there. And you can do it 2 to 3 times on each side. The next one that I find really useful to just loosen the whole posterior chain is a standing roll down. Now, what you want to do is you start by just unlocking your knees, because that means that we're not going to stretch the nerve. We're letting it go a little bit. We're going to focus on getting it moving through here. Then you start with putting your chin on your chest, curling your spine down, and just relax your arms as you go and bend from the hips. And then when you're at the bottom, you're just hanging, and you can take a few deep breaths in and out and relax into it. And then you come back up, reversing the movement, using your tummy muscles to pull yourself up, and you just uncurl. Do about 3 to 6 of those. Spend some time down there, just loosen things off. Very important that it shouldn't give you pain in any area of your body, and you should feel comfortable when you come upright. This is really useful if you found that your upper back and your neck was part of the stiffness problem when you were doing the slump test. I love arm openers to get the thoracic spine moving, and if you've got any stiffness in the upper back that's stopping your nerve from sliding, this is a brilliant one to add in. So you're lying on your side with your arms straight out in front of you. And then you just bring your legs are stacked on top of each other, and watch out, you don't let them move when you turn back. So you're lifting your top arm up, and as you lift it, you follow it with your head, and you just drop it behind you and keep following it, so that you get your chest to open, but look at my legs, they're still in the same position. And your arm may not go fully straight, you may feel a stretch when you're just there. That's okay, you stay there. Deep breath in and breathe out. Relax into the stretch a bit. You don't want to drop your arm that it goes lower, because then it'll drop to the floor, but you'll lose your stretch. So you want to keep it at that level and just bring it down. And just breathe. Few deep breaths in and out, and then you come back to the middle. And I usually get my patients to do about 6 repetitions on one side, then switch over and repeat it to the other side. Now I'm going to demonstrate the piriformis stretch and the glute stretch for you in reverse, so that you can see what my legs are doing better. So the first one is the piriformis stretch, and what you do with this is you cross your one leg over, so it's this leg I'm going to stretch, and you want to place one hand on your knee, other hand on the lower leg. Now you're going to pull with both hands. So you're going to pull with this hand down, this hand across to the shoulder, so that your leg moves across. But you only pull it until you feel a gentle stretch in your buttock. And don't hold it for too long. Just do a 10-20 second stretch and test it out. I find that often women who are in their 50s, so if you're in the menopause or perimenopause, if you're too aggressive with this type of stretch, you can actually cause yourself buttock pain. So be very gentle when you do them, and rather do short holds first. Same thing for the other side. So you're placing your foot there for reference. It can come off that leg when you pull it. It doesn't have to stay on the leg. And we're going to come across to this side now. So you're pulling with this arm, pulling with that hand, and come in. If this hurts your knee, then instead of pulling on that bit, just place both hands on the knee and pull that up and over to your opposite shoulder. Okay, then while we're in this position, we're going to do the figure 4 stretch, which is brilliant for the whole glute area. And that's literally just placing it in this figure 4 position, grab hold of this thigh and pull it to your chest. And again, you want to hold it for about 30 seconds, do 2 to 3 repetitions on each side. This one, if you have a bit of an iffy knee, it can often annoy it. If it does, don't do this one, simply do this one and hold it around the knee rather. Okay, so I am struggling to find a proper place to film this today where you can see my whole body. So I'm going to show you the important bit, which is my leg, and I'll just talk you through the rest of what I'm doing. Now, we've now loosened off the upper back, we've loosened off the bum, now we've got to, and we've loosened off the calf. Now we've got to loosen off the hamstrings. But because the hamstrings are stretched in this position, it also stretches the nerve. So we're going to keep the foot pointing down because that loosens the nerve off and just keeps the stretch located to the hamstring. So what we'll do is you're going to start with your thigh in this position, knee pointing up straight to the ceiling. Point the foot down. Do not pull the toes up because that will stretch the nerve, so you keep it pointed. And you just straighten it out to where you feel the first stretch and bring it back down. And you repeat that 12 times. And then you can switch legs and you can do it on the other side and you can come back to this side. Now, once you've done that, now we're going to keep the knees straight and we're going to use the foot to slide the nerve more. So I'm not pulling as hard as I can. I'm pulling it until I feel the first gentle stretch in the leg and there I stop. So I'm gentle calf pumps that I'm doing here. Okay. Now, if you start to feel tingling or funny sensations or anything like that, or pain, it means that this is too excessive for your nerve and it doesn't like it. So you may have to work on the other exercise more or ask your physio what you should be doing. But it's important to only add these in after you've done the other movements to loosen everything off. Okay, then for the final one, we want to do a neural slider. So we're not going to stretch the nerve, we're going to slide it, which means as we stretch it at the top, we'll bend the bottom to give it slack. And then as we straighten it out at the bottom and stretch it there, we're going to give it slack from the top. So it slides up and down. So we use the slump position. And what we do is you start by stretching it over this bit, knees bent. Then you straighten your knee out, but give it slack from the top. So you're sliding it down and up, and down and up, and down and up. So what we're not doing is we're not winding it up and keeping it there. We're giving it slack. So that's why it's called a neural slider. And you can do about 12 on each side. But always do the other ones first, that you loosen the rest up before you get to this one. And remember, if it causes you tingling or it causes you funny sensations, it means the nerve is being stretched and it's not actually able to slide. So you may have to do other things first. Brilliant. Hope you found that useful. And remember, if you need more help with an injury, you're welcome to consult one of the team via video call. The link to the website is in the description of this video. Take care.